with their parents. And they got crisis intervention services as well. But the monitoring of this family had increased significantly in comparison to the white family. So I use this as an example. And there's other examples. I'm going to share one more example. And this was an affluent family. This was a white affluent family in a pretty affluent neighborhood. And the father, a professional, was leaving the house early in the morning. And he thought his two older kids, which were probably like 8th, 9th graders, were in the home. The mother had just had a baby and she was experiencing some postpartum depression and she was sleeping. The kids had left the house, the older kids. The father didn't know that they had left the house, so he went off to work. The 2-year-old was found walking in the street. A neighbor saw the baby. The baby was in a diaper. And the neighbor took the baby back home. She did make a report and the case was reported. Child welfare came in, I guess based on what the family looked like and where they lived. This family got in-home mental health services, not even crisis intervention. The kids weren't removed. The mom was recommended for therapy and they had in-home therapy. Same situation, different family, African-American, single mom with a few kids. She was working 2 jobs. She fell asleep on the couch one afternoon. The older kids were in school and she fell asleep. The 3-year-old left the house, similar situation, had a diaper on, was walking down the street. Someone took the baby and took the child to the police station. Okay. When that happened, that child was immediately removed. And you would see the family on TV, hysterical, emotional, because their child was removed. These are situations that happen, and these are disparities. And I've been in this field a long time. It's making me upset just hearing about it. But these are the things that happen. These are the disparities, and these disparities have to stop. So.
And I guess it's worth noting that we don't try to indict the intent of these individuals who have to make these tough calls, but sometimes when the impact begins to tell a story, you can't ignore the impact, and you have to look into what's behind those numbers. That takes us to our next point here. While foster care and justice involvement impacts families of all walks, as you've pointed out, children of color are disproportionately represented and experience disparate outcomes in the child welfare system. We know incidents of poverty, I think you mentioned that, Jocelyn, implicit bias, and other factors play a role. So Dr. Dudley, where do we start in terms of trying to break this cycle?
Well, I'm probably sounding negative, but this cycle should have been broken a long time ago. And, we have to look at the fact that many children are in the foster care system. I know that many children of color are disproportionately placed. As I said, if you look at the slide and see all the children that are placed in the foster care system on a daily basis, it just makes me angry. But when people ask how is the cycle broken, we have to first look at the American society that we live in. We have to look at our systems. Systemic racism, structural racism continues to exist. Many people think that America is the richest country in the world. We're supposed to be. We're supposed to be the land of milk and honey. But we know that milk and honey does not exist for marginalized communities of color who continue to be segregated by structural racism. So until we look at our systems, and our systems are, whether it's the educational system, the child welfare system, the healthcare system, the housing system, all that, we have to look at these systems, and these systems have to change. That's how you break the cycle. People who have power, people that have privilege, have to be at the table and make the decisions and make these changes. It can't be just the Black and brown people. It has to be the people of power. And in our institutions and our systems, there are people that have privilege. And also we have to have money. We have a lot of money in this country and people need resources. And these communities and families need the resources, to break the cycle. It's 2021. And some of these same things that were happening when I started out my career as a 25-year-old psychologist, these are some of the same things that are happening today. And in some situations, it's worse. So.
Hey, Jocelyn, the same question, but with this thought added, judges, who are probably pretty privileged in the eyes of many, they sit downstream from the problem. After the damage has been done in too many cases, that's when they get involved. They're brought in at that point. How do those judges that you work with confront systemic societal issues in their critical work?
Yeah, so the Children's Commission that I work for has met for many years. We've kind of hosted a judicial work group to address the disproportionality and disparity in child welfare cases. We have acknowledged, we have data for many years now that shows very clearly that especially our Black children in Texas and across the country really, but are disproportionately removed, and they stay in care longer, and they have worse outcomes than our other kids. And so we've had a work group that's really brought together judges to think through, work through these issues for many years. And there's some kind of key takeaways that have been demonstrated over the years that are important from the judicial perspective of our members on this work group. And I think one of those, I'll bring in a couple. One is the data. It's really important for judges and community leaders to understand their jurisdiction's data in terms of race and ethnicity breakdowns across the life of the child welfare case, not just the investigation, but the whole way through. And you can understand it from the state and national levels, but the work really begins in the community level. And so addressing local issues requires understanding the local realities. And that data, and understanding that data isn't just a bunch of numbers. Those are people, those are families, and the implications for that. And then another real big task that this work group has thought about over the years is really addressing implicit bias, judges and their court teams doing their own work in addressing their own implicit biases. We all have implicit biases of all kinds. I have a great person I've worked with for many years that says, I have an implicit bias against dogs. Mine actually was cats for a long time until I got a cat myself. And now I kind of like them. But, we all have them. They're all different varieties. And it's the work of addressing those that really makes changes. And those implicit biases from the bench can create these inequitable outcomes for families of color. And I have, there's some judges that have really created a list of questions that they ask themselves before they get on the bench every time they're hearing a case. And a few examples are, what assumptions have I made as a person, as a judge, about people based on their cultural, sexual orientation, or gender identity, profession, or background? And how might my assumptions influence my decision making? And I have some judges that I work with that ask themselves that every time. They've got it memorized now. They ask those questions, and then they take the bench and they hear the case and they hear the facts of that individual family. And then they help make decisions that are addressing the needs of that family. And judges can also support the community and collaboration around addressing our disproportionality and disparity issues. We often have a tagline in our world of, if a judge calls a meeting, people show up. So judges can be leaders on this work. And then I'll just mention that in 2018, the Family First Prevention Services Act was passed, and it provides a lot more federal funding for prevention services, really trying to move our services upstream to address issues before families are needing child welfare in a real serious way. And we're working in Texas, and nationally, Texas judges are really working to figure out how can they be a part of this when they're not usually there in the prevention service realm. What can the legal community do to help prevent the families from even getting involved with child welfare?
Best way to make the judge's job easier is to stop having kids have to stand in front of those judges
That's right.
to stem the problem at its root.
Mhm.
Now, this slide talks about suicide. Makia didn't take her own life, but her actions suggested, I think you said this, Dr. Dudley, a survival instinct that overrode her sense of the consequences of her action. I mean, she was a 15-year-old girl. But let's expand the discussion to suicide, which is a problem among youth in foster care. Dr. Dudley, what's the relationship between youth suicide and the issues we're discussing?
Well, first of all, when a child has experienced multiple traumas, stressors in their life from a young age, they're going to be affected. They're going to be impacted. And what the scary messages that I'm going to say today, and it's on that slide, is that suicide is the second leading cause of death for young people ages 10 to 34. The second leading cause of death. And what's also of concern is that for Black children, the suicide rates have increased significantly. There's some research studies that say it increased 125%. Others says as much as 233% is the increase in suicide for Black youth. The Black Congressional Caucus in 2019 put out a report, and the report was called Ring the Alarm. And if you haven't read this report, please do, because it talks about the changes and the fact that Black males in particular, adolescent males, are dying by suicide at alarming rates. And many times, you didn't hear about these things. And people are saying, why? Well, first of all, we live in a country where there's historical trauma. We live in a country where there's racism and discrimination and oppression, and Black males feel the brunt of it. This is my opinion. When you have many juveniles that are incarcerated, sometimes incarcerated for petty crimes, and you're exposed to violence in communities, okay? That is trauma. When you have a parent that's incarcerated, when you have a parent that has significant mental health conditions, but is not getting any treatment, when you live in poor housing, these are the things that contribute to hopelessness and despair. And with Black males in particular, many of them are pulled into some negative peer groups where, maybe trying to be recruited to gangs. It's very disturbing. And when you don't have support system all the time, then you can easily be led astray. And many of these kids start to feel depressed. They start to think, is there another option out here? And oftentimes they feel hopeless. And when a child starts to feel hopeless, sometimes suicide seems like maybe the best option. But I also want to mention is that Black males are also engaging in self-injury. And the self-injury that they are using is more lethal than white male adolescents. And before, that wasn't something that we heard about. So it is hitting our communities, and it's very concerning. And we have to do something about it. So that's, I sound like I'm the voice of doom today, but I think that people really need to hear this. And our kids need treatment. And I'm talking about quality treatment. I'm not talking about, treatment that's not effective. And I'm talking about treatment that the people that are providing the treatment really want to be able to interact and engage with these families and these children so that changes can occur. So
I've often said hope is the last thing to die. And once you remove hope, there's nothing else.
Yep.
Jocelyn, trauma and adversity can alter a child's brain architecture, which may partly explain their link to the development of things like ADHD and what might manifest as behavior issues, which can also present similar symptoms and may complicate assessment and judgment of that behavior, especially when the responding official is a police officer, not a clinician. Youth involved in both the child welfare and juvenile justice systems present what I call a paradox that confounds the situation. Do you have any thoughts on that?
Yeah, so there's a lot of different names for our kids that have a child protection case and then end up with a juvenile justice case. That's usually the way it goes. And 92% of those cases, the first experience a child has is in child welfare, and then they are charged in a juvenile offense. And we call them, that's referred to crossover and duly involved, duly adjudicated. There's a lot of different names, but in Texas, we now have it in statute as dual status youth. And children and youth who experience abuse or neglect are at 47% greater risk of being in juvenile justice involved. And so compared to the general population. And then we also know that females and African-American youth are disproportionately represented among youth involved in both systems. And so we also know that the indicators and the risk factors for being duly involved, being a dual status youth, that are high for their mental health and their education, their vocational challenges, as well as the rates of recidivism and longer stays in detention, and also very difficult for once they re-enter the child welfare only space is their placement instability. And so from a judicial perspective, we have for years in Texas, at least, and nationally, I'm sure, had district judges that have kind of created these dual status dockets, crossover dockets, and might be in your jurisdiction something different. But where so long, once a kid received a juvenile case, they had two tracks going. They had their child welfare judge and their child welfare court team case, and then they had their juvenile case in juvenile court. And one hand didn't know what the other hand was doing necessarily. And so district judges started creating these dual status dockets to become the judge for both of those cases. And what that did was create consistency. It almost always is the judge taking on the juvenile case is the CPS judge, which means they already know this kid, know the challenges, know the family. And that really helps to address the needs from a much more knowledgeable and trauma-informed way, to be able to say, I already know there's trauma here, so let's deal with that. And so we have had district judges that have been able to do that over the years. And Texas also has 30 specialized child protection courts around the state that are legislatively created, and they exclusively hear our child welfare cases. And recent changes to the law now allow those child protection judges to also hear the juvenile case. And so we've had some pilots that the Children's Commission is helping facilitate to teach those child protection judges and work out all the logistics of transferring cases to juvenile cases over. And we hope to kind of spread that out and have all of our CPC judges, which hear a very large amount of our child welfare cases here in Texas. So we're hoping that addressing that will really, at least from a judicial perspective, create better outcomes for those kids that end up with both cases.
It's really about healing the individual holistically. While we can look at them for what their behavior, how it manifested, we often in law look for mitigating circumstances and things like that. So it seems more fair, at least, if you have to punish someone, that you take into account the things that you know are a part of that individual's judgment. And in some cases, we don't consider people at a certain age old enough to make sound decisions, especially when adults are involved. We saw a lot of statistics, and the statistics didn't say that any one problem was 100%, maybe except the ones where it showed the increase in Black male suicide. But statistically, there are some success stories, notwithstanding some of the inequities we talked about. When you do see success stories, what do you believe were the differences in that case where it involved a youth in the system. It looked dire, but it turned out well. And we'll have Dr. Dudley start with an answer, and Jocelyn, you finish up with your own thoughts on that.
Okay, I know I'm sounding like, very negative, and there's always the focus on the cases that really strike home that are negative when, the negative stories, but there are some positive stories that do come out of the system. And I think the most important part is if a child has a support system, even if it's not the family, if there's even one person who takes an interest in a child, becomes an advocate that stands by them through thick and thin, throughout the placement, that is so important because we talked about hopelessness. This gives a child hope. And it doesn't matter who that person is. It can be somebody in the community. It could be a relative. It could be a neighbor. It could even be a teacher. And, people say, I always tell stories. So I have a story that I want to tell where a child who had been in the system and was in the system really up until, he graduated from high school. And I was talking recently to a friend of mine who was a psychologist, and she was a white female psychologist. And I don't know how we started to talk, but sometimes my conversations come up about race and, disparities in the mental health system. So, I was giving her my opinion about some things. And so at one point, she told me about her daughter, and she said, Charma, my daughter is a teacher and she works in a specialized school. And most of the kids in the school had significant behavioral problems. And one kid she really got attached to. It was a young African-American male that she knew at 14 years of age, really smart, had a lot of potential, but his family, things were just breaking apart. Father was incarcerated. Mom had significant drug and alcohol issues. And this kid was involved with some drug activity in the community. This teacher still worked with him, gave him, positive feedback. You can do it. You can do it. Eventually, this kid graduated from high school, and she had helped him fill out some job applications and college applications. He got into a college. She drove him to college. It was a rural college, like I'm going to say something maybe negative, out in the boonies. And this was not the place for this kid. So in a couple months, he's calling this teacher and he's saying, I got to get out of here. So she went to get him, tried to get him on the right track again. He got involved in some negativity in the community and was incarcerated himself. This teacher still connected with him, and he's still connected with her. He finally got out and still was kind of involved in some shaky situations. And she continued to give him positive feedback about what he can do, that there was hope for him. And he found out that he really liked in cooking. He liked to cook. So this teacher said, why don't you maybe look into culinary school? He was like, culinary school? Long story short, she helps him fill out some applications for a culinary school. He gets in the school, graduates from the school, and the only person that came to his graduation was this teacher. And you know what? This young man is now a chef. That's a story, a positive story. And I know there's many like that. So it can be one person that shows interest, that goes through this child with this child trials and tribulations and doesn't give up. That's what our youth need. So that's one of my success stories that really wasn't mine, but it was a friend of mine's daughter who did her best and stayed in touch with this kid, and they still stay in touch today. So,
Jocelyn, do you have any particular examples of one that stayed with you of a success story?
Yeah, I'll echo Dr. Dudley and just saying in the trauma-informed circles, we often say that it really just takes one trusted adult to help a child realize their resiliency they've had all along and build those protective factors that can take them into adulthood. And a sense of belonging is really key for that. At the Children's Commission, we really strive to bring parents with lived experience and children with lived experience into our work to inform it from those that know and understand the system best. And we've worked with several young adults now that have been through the system and are thriving. And I can tell you that the kind of string of the consistent theme for all of them was that they had at least one trusted adult, and that was, in one case, it was a judge, and that man is now, working on, I believe, his second master's, and doing amazing work in advocacy for youth in care now. And another was a foster parent, and that a young woman is in law school, and we have others that it was an aunt and a church member. It doesn't have to be, it's not a recipe, one recipe. The ingredients can be different, but the reality is that we can build in our kids the resilience and protective factors they need, no matter what their situation is.
I love hearing that part of it, even as we have to be honest about the depth of the problem. We do have to celebrate the wins, because that's where that hope comes from.
That's right.
I would say that trauma seems to be a thread that runs through most cases. Jocelyn, do we underestimate the role that trauma plays when dealing with kids in the justice system? We talked about the dual status of some of these kids, but do we underestimate the role that trauma played in these cases when we're talking about kids in foster care?
Yeah, I think we have historically definitely underestimated traumatic experiences of our kids in juvenile justice and also in child welfare. Even more basic, I feel like in juvenile justice, we've often created systems, and maybe some child welfare, we've created systems that's really ignored their basic human needs, which clearly can affect their mental health and thus their behavior. Not having access to water and food when you need it on a regular, a normal basis. Like especially for everyone that's been working from home, knows that one can need a lot of water and snacks, the appropriate sleep for adolescents' health and their brains, and the need for just acceptance and belonging. And I think our kids in the juvenile justice system are coming to us. They come with this whole life story before they ended up in detention, and they enter that system with all of those experiences. And often the same for our kids in child welfare, and their behaviors can often, I think, present as problems that we need to remove and solve, rather than traumatic responses to hard experiences. A lot of our kids are coming from hard places, and there's underlying pain and grief there, and probably a lot of confusion about what's going on in their life. And not to mention the reality of just being a human developing in this world, which is complicated no matter what stage of growing up. And so, although I don't work for the Texas Juvenile Justice Department, I do know that they've been doing a lot of work over the years to really create a trauma-informed system, and they're trying to work on creating facilities that address the needs of their kids, down to just giving them a water bottle to have their water all the time, and giving them tools to be able to tell the staff when they are having a hard time with their emotions and their behaviors. And I think they're also working on training the staff to understand and recognize the signs for dysregulation, and really help those kids build those skills to regulate themselves, so they're coming out with skills they can use in real life.
I'm going to give you the same question, Dr. Dudley, but I wanted to bring this slide up because it refers to ACEs. What is ACEs in practical terms? I'm going to skip ahead another slide.
Sherman, do you mind if I go back to the one on disparities? I just wanted to pick a little bit off of what Jocelyn was saying about disparity. And I think what's really significant about this slide is we see that approximately 50 to 75% of youth in the juvenile justice system have an untreated mental health condition. And many of these kids are in the system because their mental health conditions weren't treated in the first place. And I just wanted to say that in my work as a psychologist over the years, I have seen disparities that exist in clinics, inpatient units, many agencies that I've worked at. And I just wanted to give this example. Oftentimes children of color are diagnosed with ADHD and conduct disorders and other disruptive behavioral disorders. And many times when I'm doing rounds or hearing cases, I will hear how a white child may be in the classroom and is struggling too, having difficulty focusing, paying attention, is distractible. And the parents are told that this child needs a psychological assessment and that maybe he needs some therapy, and gives, parents some behavioral management techniques. And those are all good. Those are all considered least restrictive type of interventions. Oftentimes when it's a Black child or a child of color, and the child is distracted and, fidgety, off task, immediately this kid's ADHD. Now, the white kid might be ADHD too, but frequently when a child has ADHD and maybe a child of color, what happens is sometimes they're put in specialized classroom. Sometimes they don't get a comprehensive assessment. And usually what the teachers say is that maybe this child needs to be on medication. Okay. So the therapy didn't happen. The comprehensive assessment didn't happen. But the parent is told, in order for this kid to get back into the mainstream classroom, you might want to see if he can be put on medication. I mean, this does happen. And that's when I see the disparities. We also have to look at kids who are traumatized, that may be in the classroom, that may be fidgety and distracted. It's not that they're ADHD. These kids may be depressed. Maybe these kids aren't getting enough sleep. Maybe these kids have been up all night because they hear gunshots in the community. But many of these kids, the first thing that people say is maybe they're ADHD, maybe a disruptive behavior. I had a kid that I worked with, he was truant from school, and he was distracted. It was because this kid was so anxious because one of his friends got shot being a part of a gang, and this kid was traumatized by that. So when he went to school, he was distracted and not focused at all until it came out in therapy what was going on with this kid. So I think it's really important that no matter what the race or ethnic background of a child, if someone said this kid's ADHD, just don't assume that's what it is. It could be, but do a comprehensive assessment. Ask about anxiety, ask about depression, because frequently kids who have been traumatized have undiagnosed depression, anxiety, and definitely post-traumatic stress disorder. 40% of kids who live in violent neighborhoods have PTSD, but they're not getting treatment. So I just wanted to kind of piggyback on that, Sherman. So
just two interesting notes. And now we've got kids going back to school this fall after living under pandemic times, whatever that brings for that particular household, where adults are stressed out, some may have lost their jobs, some are frustrated, a lot of arguing, there may even have been breakups, domestic abuse, and it's been hidden, tucked away for a year and a half for a lot of people. And now we're asking them to go back into these environments where it feels dangerous. If you were an eighth grader and now you're a freshman this year, we remember our freshman year and how tough that was. But you add the elements now that they have to face, and the teachers are the ones that have to figure out, is it misbehavior or am I seeing something different? And that's a lot to ask of teachers who have a hard enough time being teachers and everything they have to do for so many kids. And I want to jump ahead to the ACEs slide, because this kind of takes us in that direction when we talk about adverse childhood experiences. Jocelyn, you brought this slide to my attention, and I'll have you weigh into as well, Dr. Dudley, but can you describe your understanding of ACEs and what this particular illustration tells us about the complexities and intersections?
Yeah, so folks may or may not be familiar about the adverse childhood experiences study that was done in the 90s, and is a seminal work in trauma and understanding the impact of trauma. But it was, of course, they kind of narrowed it down, the original researchers, to these 10 items, 10 adverse experiences. And over the years, there's been a lot of expansion and understanding that we aren't beholden to only 10 items that might happen in our life that that could cause trauma. And so this is developed by, it's actually now called PACES Connection. They just changed their name, but the ACEs Connection people might be familiar with. That I think it really illustrates so well the kind of human condition and just the reality of living, and how many different places families that you're working with might be experiencing traumatic experiences. And so they call it the 3 realms of ACEs, and it's got the roots, and it's got the, that are more structural, historical trauma, structural racism, underlying conditions. And then you've got the leaves that are a little bit more the interpersonal trauma, and a lot of the 10 ACEs that originally populated this field. And then these environmental factors, which I'm glad that they actually updated it last year to add pandemic, which is a sad reality, but it is absolutely a factor, a shared trauma for all of us. And I share this as much as I can with our judiciary and the work I do with our trauma-informed collaborative, because I think it's such a beautiful illustration of all the complexities of the kids that are coming into care and their families and their caregivers, and what they're facing, and how we need to be aware and looking at every aspect of their lives as what's brought them to be in court. And a family maybe having a personal trauma, there may be substance use disorders, but we know that way too many parents who end up with a child welfare case were once children in the child welfare system. So we know that there's work to do in improving our system so that it's helping families heal and keeping them together when at all possible, and know that that's a best practice is keeping families together so that they can weather these kinds of traumas that come after child welfare is involved, with resiliency. And then just acknowledging that, I'm so glad they put historical trauma and structural racism in the roots of this illustration, because it's really baked into communities and policies that might be perpetuating the inequitable outcomes for families of color. And so acknowledging it as a piece of the puzzle when you're trying to work with a family, I think is really valuable.
And Dr. Dudley, this is a screening tool that a lot of us can go on the internet and take the 10-point test that Jocelyn mentioned. You as a clinician, though, you have to take it to the next step. Maybe diagnosis needs to occur. How do you use this information, and what advice would you give parents who, or even a child takes this and finds him or her pretty high on this test? What would be the next step?
Well, I think depending upon what comes out of it, you as a mental health professional, anyone can look at what the needs are. This really identifies what the child and family's needs are, whether it's housing, whether it's, medical care, whether it's behavioral health care. This is what we look at. And I also want to say too, with ACEs, that we found that in some of these studies, 60% of African-American or Black children have more than one ACE. I mean, it's like, I think Jocelyn did a good job talking about, adverse childhood experiences. So I think you find out what the needs are, what is affecting the family, what are the barriers, and work to help resolve them. And I just also want to emphasize, when you look at things like trauma and divorce, incarceration of parents, drug and alcohol, mental health conditions, and all these ACEs, if they're not dealt with when a child is young, when they become adults, their functioning is disrupted. They may also have a mental health problem. They may start to use drugs and alcohol. They may be homeless. They may be incarcerated because these ACEs that were identified at a younger age, they weren't addressed. So it can become a vicious cycle.
And I'm looking through some of the questions that have come in, and we're gonna round the bend now by wrapping up on
Okay.
what work you all have been doing and some of the resources that you can point people to who might be interested in learning more. Jocelyn, this is a report that I read online about what Texas has done to build a trauma-informed child welfare system. Can you talk a little bit about the guiding principles and other aspects of the report?
Yeah, I would be happy to. So the Children's Commission staffs a statewide collaborative on trauma-informed care. It was initiated in 2017. When I came on board with the commission in 2018, we had work groups that were working on developing strategies and creating a blueprint for building a trauma-informed child welfare system. And through the work of our work groups, we released this blueprint. That cover right there is the cover of the report. And through the work groups work and there was over 100 collaborative members in the development process of this. We kind of narrowed in on these 9 guiding principles you see on your screen that really guide the work. And then nesting underneath all those guiding principles are our goal, our objectives and strategies for how to move our system forward. It's not meant to just be for the agency or the judiciary or the service providers. It's really meant for everybody that's involved in child welfare to be able to take up a piece of it. Everything may not apply to you, but something in there does, and really be a collaborative effort in moving our system forward. And I'll just note there that what was really important to the collaborative members in building this report was the equity, that number 3, and that we cannot have a trauma-informed child welfare system if it is not equitable. And so we really use all of these guiding principles, and we're now in implementation. We have an implementation task force. It's kind of, I actually kind of feel like we're moving into phase 3, but in phase 2, we kind of slimmed down the group and created 3 work groups that started in 2019 and have now each put out they've been working on different things. Our policy and practice work group was instrumental in helping the Department of Family and Protective Services. We provided a trauma definitions for trauma and trauma-informed that were eventually adopted into the Texas Administrative Code for the department. And the policy and practice work group also worked on creating a database of trauma-informed organizational assessments for service providers to be able to kind of evaluate how trauma-informed their system is, to be able to pinpoint where they need to improve and work on. And then the training work group was instrumental in helping us at the commission put on a Judicial Trauma Institute in April of 2021, and then also helped create a database of trauma-informed resources that are available online. And then in our funding work group also helped us kind of think about next steps of what was called for in the blueprint very strongly by all the work groups was a Texas specific website. So we're working on how that might come about and what uses that would have for the child welfare world. And in the meantime, the Children's Commission, we created a website, kind of a landing page on our website called traumainformedtexas.com. And that's where you can find all the resources that the collaborative has been working on. There's all of the recordings from the Judicial Trauma Institute are on there. Our audience specific one-pagers on training are linked on that site. They go to our partner on that project, Mental Health Technology Transfer Center, and that's funded by SAMHSA. And then also our organizational assessments are on there as well. And I'll put the link in the into the chat. And then I just want to note that, this is focused on the child welfare system, but we recognize our kids in care are involved in lots of other systems. And so we're working and we're trying to be aware of the work going on in other systems. The Texas Education Association has been working on some trauma-informed materials, and they recently launched a website that has a lot of useful resources for schools as they're trying to move towards more trauma-informed approaches for their kids, which is critical, and I have a lot of hope in that work. And even for all you local Bexar County folks, and I think there's another session that probably will give a lot more information about that. There's a great local collaborative called the South Texas Trauma Informed Care Consortium that's really working on a holistic approach to the city and moving the whole, a public health approach to moving everybody towards trauma informed. And lastly, I'll just mention the Texas Children's Mental Health Care Consortium, which it was legislatively created and is working diligently to address the huge mental health needs of our Texas kids and the service gaps that are clearly, especially for a state our size, there's a lot of access issues, and they're working on improving those and trying to bring more providers to Texas to care for our kids' mental health.
Dr. Dudley, you've got a litany of resources. I saw your YouTube clip about reducing health disparities through culturally competent care offered on the Beacon website. There's a screenshot there. You also talked about the Ring the Alarm report and the Children Defense Fund. Can you talk a little bit about what these resources are and how they might inform more people?
I think they're excellent resources. I got so much information from the Children's Defense Fund. I mean, they put out a report. I don't think it's every year, but they put out a report that has data in it, talks about, the mental health system, the child welfare system. It just provides a lot of significant information, statistics, and, just an overview of what they're trying to do. And so I would recommend people to look at it. I look at it whenever I can, and I get a lot of significant information. Ring the Alarm is the one that I talked about that was put out by the Black Congressional Caucus. And this is addressing Black youth suicide in America. And I think this report is an excellent report. And there were some things in there that I wasn't aware of. So, but you don't hear about these reports that often. So I would recommend that people take a look at that. That little stint that I did for the YouTube, anyway, it was okay. But for the most part, I was trying to emphasize that if you are in the mental health field, the healthcare field, whatever field you're in, you have to be culturally competent. And, Jocelyn mentioned that, with trauma-informed systems. And I would agree. First of all, you have to look at yourself. If you want to be effective when working with people that don't look like you, you have to look at your own biases, you have to look at yourself and examine who you are. And also when you're engaging people, in order to be culturally competent, you have to listen and understand where they're coming from and get to know who you're working with. Ask them about their traditions, their religion, what they believe in. That's how you get to know people. And during the past year, I have a very small private practice, but I talk a lot with therapists and clinicians. And the first thing that I ask them, during the past year with COVID, and the racial injustice, George Floyd's murder. How many of you have actually talked to your clients about that, how it has affected them? How has the Capitol riot affected them? These things are so important, but if you are afraid or reluctant to engage your clients with things that can affect them, then you really need to take a step back. And also about cultural competency, it's about sensitivity, it's about awareness, and having the skills to work with people that may be different from you, that may have a different worldview. And it can be done. So, and also with training, it can't be a one-stop shop. So if you're working in an organization where they do one training or they make you listen to a video one time a year, that's not cutting it. It has to be ongoing conversation. And some of these conversations may be difficult to have. So I don't know if I answered your question, Sherman.
You did, Dr. Dudley. And we're going to get to some of the questions here with the last few minutes we have. I just wanted to quickly mention some of the work that the National Alliance on Mental Illness is doing to help the cause. We are a major proponent, I would say the lead proponent of the 988 bill that established this 3-digit number for crisis response as an alternative to calling law enforcement when you have someone who's experiencing a crisis. However, it's not enough just to change a number. We need systems behind the number so that when you do call the 988 number, the individual who is in crisis has a place to go. A crisis call center hub can send that individual to the appropriate level of care that he or she needs. Mobile crisis teams should be deployed to address some of these issues. I don't know if a mobile crisis team would have made a difference in Makia Bryant's case, but what we do know is that her little sister called 911. And when the police got there, it had escalated to a point where it was beyond anyone's control. And we saw what happened. And then lastly, crisis stabilization. It's not enough to treat an individual in an ER without giving that person somewhere to go to get the continuity of care, to not just get past the crisis, but to stave off the crisis in the future when triggers happen. So this is what NAMI is doing to help the cause. And we invite everybody who's watching this to read up on 988 and what we've been doing to encourage the grassroots and everyday citizens to get involved at getting this implemented at the local level. What I'm going to do is go to the next slide and ask a couple of questions that were posed in the chat box. One is from, let's see here. Gonzalez asked, Dr. Dudley, do you feel that children of color are as well served with Caucasian adults leading support systems, or do you feel that having someone that looks more like them is more impactful?
Well, I think that it's always good if you can have a diversity of clients, people of color serving communities of color. Sometimes in my private practice, I'll have a Black client that comes in and says, I've been in therapy before, but the person didn't understand the racism that I was experiencing at work. Or, you know, the teacher who said something about my child. So sometimes it's good if you can find a person that looks like you, but it doesn't mean that other people who don't look like you can't do the work they can. But what needs to happen is it has to go back to the cultural competency. You have to be ready to engage and try to understand where that person is coming from. And don't, you know, say that's not what it is. I'll just tell you another little story about my niece. She'll probably kill me that I'm talking about her, but she had a history of depression and anxiety, and all the therapists she was seeing was white. And the last therapist, she said to her, do you really think that happened? Do you think that? And she says, she called me, she said, Aunt Charma, I have to find somebody else. This therapist, she's nice, but she doesn't understand anything that I'm going through. So I think that therapists have to be engaged with clients and be willing to get clinical supervision consultation when they don't understand, because there's more white therapists out there treating people of color than there are Black, Latino, Asian therapists. When you look at psychologists and psychiatrists, I think that maybe anywhere from 2 to maybe 6% are of color. And I'm thinking mainly maybe Black therapists. And so the numbers are small. So we have to work with those out there that are doing the work to make sure that families of color are being served.
Jocelyn, here's a question from Mary Baird. She makes a statement, but the gist of her question is, it's really hard to get parents to see how they contributed to the problems and how they created traumatic situations for their kids. How can we get parents to do the work they need to do without the force of law? Is there any way to do that?
Well, you know, from a system standpoint, prevention and early intervention services, PEI under the Department of Family and Protective Services is aimed at that, and they are doing a lot of work in making sure that the services they're bringing under their umbrella are culturally appropriate and they have diversity in that regard. I almost feel like that might be more of a question for Dr. Dudley as far as from a clinical standpoint, but I think that we can, I'll just say as a human, coming alongside somebody as another human and I'm quoting one of my panelists from our Judicial Trauma Institute that said, bring your human. She's a former parent in the system and now a parent advocate. Bring your human to this work. And talk to those parents as though you understand that it's really hard to be a parent, and not from an authoritative, I'm going to take your kids away kind of mode. And I think you're going to come along a lot better with other people if you're just bringing your own human to it.
Right.
Got about a minute of a response, Dr. Dudley.
Yeah, I would agree with what you're saying, is that you can't blame the parents. You come with the attitude saying, well, what do you need to do? I think we need to go into these situations with some compassion. And, we know that being trauma informed is not saying what's wrong with you. You have to say what happened to you. What is your story? Because many of these parents, we talked about adverse childhood experiences, have been through the same thing. And intervention and prevention programs are very helpful in getting treatment early. So that would be my add-on.
Well, we did have other questions, but we're going to run out of time. I've got to give some CEO instructions. Dr. Dudley, Ms. Fowler, you've done an amazing job helping educate us on the topic. I hope that the audience appreciated not just your experience, but the heart that you bring to your work. And for that, I thank you.
Thank you.
Thank you. Thanks to everyone attending.
Now, for all of our attendees, you can find a recording of this workshop on the NAMI San Antonio YouTube channel. If you would like a copy of the slides, you can find them on the Pathways to Hope website after the conference. When you close out the session, a post-workshop survey will pop up in your browser. We value your thoughts and use the feedback you provide to help shape future conferences. And I'm already looking forward to next year. Also, it is required that you complete this survey if you are seeking CEUs for this workshop. I thank you all for attending. See you next year.
Thank you.